Tse, ma'am, I hope I pronounced your name accurately, because this video is for you and every other person out there that's been getting it all wrong about the eye care practice and professionals. I bumped into this video you made a few months ago, and after watching it, 3 things caught my attention and I decided to reply you with this video.
So I've been beefing someone for 26 years, and this is why. The person, I don't even know who the person is. I don't remember what they look like. I don't know their name, but they're the optician or the ophthalmologist or the optometrist, I don't know what they're called, that diagnosed me of myopia 26 years ago. And when I was crying because I didn't want to wear glasses as a child, told me, don't worry, wear your glasses, your eyesight to be corrected. As long as you wear your glasses, after a couple of years, you'll be better and you'll see. And it has never gotten better.
In this video, you said, number one, that you have been beefing somebody for 26 years now, and that you don't even know who the person is called, that you feel is the optician, ophthalmologist, or optometrist. Secondly, so that the person deceived you into wearing glasses, that the glasses was going to correct your eye problem, because then you were younger and didn't want to wear glasses. The third thing you said was that even after wearing these glasses for these years, that your vision keeps deteriorating, that there is no improvement. First of all, I'm going to start by correcting you on how to pronounce this profession, because you did not pronounce it very well. In eye care practice, we have different professionals that come together in order to give you people in the hospital the best. But there are three major ones that we are familiar with. They are the optician, the optometrist, and the ophthalmologist. The question is, who is an optician, optometrist, and ophthalmologist? An ophthalmologist is a general practitioner that later specializes in eye care management. They are mostly involved in carrying out surgical procedures that has to do with the eyes. Example of these surgical procedures include cataract, glaucoma, cornea repair, retinal repair, and rest of them. These are what the ophthalmologist does. And the best way to pronounce this is not ophthalmologist, is ophthalmologist. Have you taken that? Well done, ma. The second person there is the optometrist. An optometrist is a primary eye care practitioner or an eye doctor that is responsible for carrying out clinical examination, diagnosing and treating patients with eye problem using eye drop, tablet, or glasses. So this is to say that it was an optometrist that gave you these glasses. Now you know who gave you the glasses and what they are called. Now the last person in this list is the optician. An optician is an eye care technician. Now what happens is that this optometrist will carry out this clinical examination. After carrying out the clinical examination and now say, okay, this is your eye problem, what we need to use to treat or manage it is giving you glasses. So he or she will take the prescription and send it to the optician. The optician will now chip and fit this lens into this frame. That is the work or job of an optician in eye care practice. This is to say that an optometrist is the only person that has the right to give you glasses. An ophthalmologist cannot do that, and an optician cannot do that. Have you gotten that part? Well done. Another phase is that you said that this person deceived you into wearing glasses because the person, you were told that wearing glasses will correct your eye problem. This is the part I need to hammer very well. Wearing eyeglasses does not treat or correct your eye problem. The treatment or correction done using eyeglasses is temporal. What do I mean by temporal? Now, you know, before the clinical examination, before they start testing you, they will give you this to read, Abi. Now, let's say before they give you glasses, it's only this A you can see. And if they give you glasses, you start seeing there. Immediately, you remove your glasses from your eyes. Now, only A you go see. It is only A you will see. It's not magic. And this is because your problem is coming from surface, how your eyes is bending light. So your eye is not bending or refracting light properly. So we'll give you these glasses so that it will help to bend the light properly so that you can be able to see. So whatever makes you to remove these glasses from your nose bridge, your eye will go back to square one. That only A you are seeing is what you will continue seeing. It is not going to cure. It's not like it's going to not cure it inside. Because I used to have some of my patients, especially myopic patients, asking me if I want to give them glasses. They say, so doctor, how long will I wear these glasses? Doctor, is it after 1 month? I used to tell them the truth. I'll tell you, no, it's not just 1 month. It's not just 2 months. You are going to be wearing it forever, because the moment you grab these glasses away and remove it from your nose bridge, your eye will go back to square one. So why did he deceive you or convince you, like you said, into wearing glasses? You were a child that time, obviously you're myopic and was not doing very well. The only option he has is to convince you into wearing these glasses. What you guys don't understand is that as a child growing up, if you are not seeing very well, this can cause the child to perform poorly in school. And for you to be able to see the class board very well from your seat, you need to wear your glasses. That was why this doctor convinced you into wearing these glasses. He or she was not deceiving you. Lastly, you said since then you have been wearing these glasses that your vision is still deteriorating. You are still wearing glasses. The reason why you are still wearing glasses, or the reason why your vision is still deteriorating, could be that the type of myopia that you have is the progressive type of myopia. We have different types of myopia, but progressive myopia is the type of myopia that requires a myopic patient to keep changing the power of his or her glasses, mostly annually or every 2 years. Now, what is progressive myopia? Progressive myopia is the type of myopia that is due to abnormality in the axial length of the eye. The axial length simply means the length of the eye. Now, when a person is born or is growing, the axial length of this person is usually around 70 millimeters. When the person gets to adult stage, like me, the length of the eye grows from 70 millimeter to 24 millimeter and stop growing. Unfortunately, some persons will keep growing from 24 to 25 to 26, and that is a problem. This is because the retina, where the light that is entering the eye that forms the image, is not too far from the light source. So this person will not be able to see unless he or she is wearing glasses. So sadly, especially myopic patients, their eyes keep growing. And the more it is growing, the more the need for you to change your glasses. And for every millimeter increment in the length of your eyes will require like 3 dioptric power to change it. Let's say, for example, last year you were wearing -2. And this year, because your eye is progressing, come to an eye clinic or an eye doctor and you say that you cannot see very well again with that glasses that was given you last year. It means we will have to add extra 3 into the 2 that you were given last year. That will be like -5. So if it keeps growing, your eye is not stopping, the growth is not stopping, and you come next year too, you have to change. That is why some people are wearing -6, some people are wearing -12. I've seen a patient wearing -11. That is how bad it can be. So don't think the glasses is permanently going to, no, now are you putting it inside your eye that it will permanently cure your eye? No, now you're wearing it in front. I hope I was able to answer this question. Don't mind the way I sounded anyway. I hope you follow me.